Hi, I'm Dr. Lisa Grant, and I practice general internal medicine here at UW at the Westtown Clinic. And my area of interest is in participatory medicine. And really that means I'm interested in the things that patients do in between their visits with us to promote health and healing, and hopefully how those things reduce healthcare costs. And for years, I've also taught stress reduction, meditation, and mindfulness in the community. So I'm bringing those modalities into sort of the patient setting. So I decided to teach a stress reduction class because stress seems to be present in almost every clinical encounter with patients, either directly or indirectly. And when I ask people, what tools do you have to manage stress? A lot of times I just get a blank look, like I didn't know there were any tools. So I decided to teach a class, which was primarily based on mindfulness. So introducing participants to awareness practices, mindfulness being sort of the main tool that we explored. And then we also explored the ways that stress manifests in the body. So a little bit of a light medical discussion about stress physiology, autonomic nervous system, the fight or flight response, and how we're affected by those things. So it was a really short time-limited class. We met for an hour a week for 5 consecutive weeks to learn stress reduction tools. And the class was targeted to people who tend to have frequent clinic visits. So anyone who had more than 4 medical visits within a 6-month period of time was told about this class and offered an option to attend. And so we looked at a couple of objective measures. So patients did something called a perceived stress scale, which is just a 10-point questionnaire about our relationship with stress. And they did it before the class, they did it at the end of the 5-week class, and they did it 6 months later. And you can see that the mean score of perceived stress went down and continued to go down in a significant way that was sustained over time. So that was pretty exciting. And then I was interested to see if this sort of class would reduce healthcare costs. So I just looked at the number of medical visits, outpatient visits, that participants had for the 6 months before the class to the 6 months after. And I was interested to see if there would be a change. So you can see here that the mean number of visits before the class when compared to after the class did go down. And when you looked at the highest utilizers of that group, it went down in an even more interesting, significant way. So it seems like the group of highest utilizers perhaps have the most to gain from self-care strategies, and that'll be the group that I target maybe in the next wave of the project. So basically it's a low-risk, low-cost intervention that's aimed at bringing ease and stability into people's lives, and hopefully decreasing costs for the healthcare system that cares for them at the same time. So